Welcome back.
Thank you.
Yes, we were having a very interesting discussion on the issue of infertility, and you were talking about the advancement in the treatment. Can you elaborate more on that area?
In the last 25, maybe 30 years, a specialty has evolved in OBGYN that deals with what we generally refer to assisted reproductive technologies. And basically, in this field are women who have exhausted all the basic investigations, have exhausted all the basic treatments, and they're still not getting pregnant. And along came the assisted reproductive technology, which most people know as in vitro fertilization. And in vitro fertilization is a technique where the first step in pregnancy, which is to get the sperm and the egg to meet, can be achieved outside the human body. And the resulting zygote, it would then be developed to a stage where it begins to multiply up to a point before being put back in the woman to grow. And that's the basic tenet of in vitro fertilization. The question is, why would a woman need in vitro
do that?
fertilization?
Yeah, that was going to be my next question.
Generally, as I stated earlier, when you have the when the eggs are being produced, the sperm is good quality, but the tubes are blocked. In the past, we've gone through trying to repair the tube.
Yes.
But what we found was repairing tubes has a very poor success rate.
And is it possible to have an ectopic with those kind of things?
Yes, and when in fact you're successful in repairing the tube and pregnancy does occur, the risk of ectopic pregnancy in such situations is triple the normal rate. So that in trying to find answers to this puzzle is how in vitro fertilization came along. So generally, in vitro fertilization is indicated when you have blocked fallopian tubes. In fact, in my practice today, rather than advise women to go through extensive surgical procedures to repair the tube, I just refer them to an infertility specialist who is capable of doing in vitro fertilization.
How about this issue of rent a uterus type of thing, in which some other woman would, who is not married to the man, they will put the...
Now, when you get into this realm of assisted reproductive technology, you then come into other various issues. You have women where they have good eggs, the husband has good semen, but either because of something in the past, they had their uterus removed, had a hysterectomy in their younger days, and now still want to get pregnant. Then you can get into the area of surrogacy. You can have a surrogate parent where the couple, the egg and the sperm biologically belong to the couple. So it's their child.
Yes.
But they can pay another woman to carry that pregnancy.
How expensive can that be?
It can be expensive, and sometimes it can be free, because sometimes you have family members volunteering to assist couples in achieving this goal. But in the instance where you have to pay someone to do it for you, they can get very expensive. And so it depends on what kind of agreement you have with the surrogate mother. Not only to pay to carry the baby, but also fees relating to the medical care of that woman while she's pregnant. All of that will be borne by the biologic parents.
What if she changes her mind and begin to say that I carried this baby in my womb for this length of time, it's my baby?
Well, that has been known to happen, and that's why before couples get into this sort of agreement, they should definitely consult a lawyer so that the agreement is airtight to prevent this. And if the woman goes into this sort of agreement and agrees to carry the baby and the legal papers are well drawn out, she's not likely to prevail. She's not likely to prevail because that would be a breach of contract. But if the contract is not well written, the couple may run into problems. And as you can imagine, with this field has come a lot of abuse, on both sides. Couples have been known to take advantage of surrogate parents. Surrogate parents have been known to take advantage of couples. But when it's done in well-meaning situations and all the legal papers are well drawn, it's a viable option that's available to infertile couples.
Interesting. Any other advancement in that field?
Yes. In the early days of in vitro fertilization, there was still a lot of hit or miss, where the egg is placed in a petri dish full of sperm cells, and you would then just hope that one of them hits. But in the last, I would say maybe 5-10 years, has come a new technology that we call intracytoplasmic injection of the sperm.
What does that mean?
Where under very sophisticated electron microscopy, you can actually inject one sperm into an egg to fertilize that egg. And this has been a wonderful development for couples where the man may have a very low sperm count, sometimes almost zero sperm count, but you can actually go down into the testicle of the man and harvest just one sperm and use that sperm to fertilize the egg from the female partner.
Are they doing this only in very big tertiary centers, or
no? Actually, there are private infertility clinics all over the country that have well-trained doctors in this area.
So the average couple can afford to do that.
The cost is another issue. It's a very expensive procedure. In vitro fertilization in general is very cost prohibitive. And what you find is most couples have difficulty affording this.
How about insurance coverage?
Most insurance plans do not pay for this. It's usually cash based.
Well, why wouldn't they want to pay for it? Do they consider that cosmetic? Or
because it is believed that pregnancy is a choice thing. It's not technically illness. Health insurance is supposed to cover your preventive health and acute illness. whereas pregnancy is a choice that we all make. And using that principle, insurance companies have been able to avoid paying for things to do with sophisticated reproductive technology. A new development is now finance companies have now evolved to assist families in being able to meet their goal. And a lot of times what I tell my patients is, you know, if you can finance a $30,000 car,
yes,
why not a $30,000 child? Yes. You know, and the finance companies have made this possible. You can reach an agreement with a finance company that would finance the whole process, and you draw up a contract of a payment plan to pay them back. We as general OBGYN practitioners do not have access to these finance companies, but when you go and see the infertility specialists that do this, they usually have relationships of people they can direct you to finance it. And sometimes some of them have in-house financing to assist couples to meet these challenges.
I think if I have a sister or a female friend, I will advise them to go that route, because the analogy you just gave us, the quality of life, if they're really looking for a child, the quality of life, life that is
what the expense.
The value added is what the expense.
Yes, it is. I agree wholeheartedly that. It is what the expense.
I mean, you've given us a lot of information today. I know you're a very busy practitioner, and I don't think you can have time to tell this to a single patient in a visit. But what we're going to do is to make sure that our viewers know where you are, and for whatever education you can give them, I'm sure they will appreciate it.
Yes, I'll be happy to. I'll be happy to. It is always worth it to take the time with people who are facing these challenges. So yes, I do in fact spend time to educate patients who have this need, and many of them are very appreciative. And the good news is, in vitro fertilization and the assisted reproductive technologies actually have proven to be quite successful in a cumulative sense. You know, most successful centers, for every 10 patients that go through in vitro fertilization, 3 to 4 of them might be successful on the first round. But the next round is another 3 to 4. So you start out with 10 patients. Generally, by the time they've gone through 3 cycles, 8 of them might already be pregnant.
Interesting.
It's a very, very successful development that we have in this field.
We really appreciate all the information you've given us, all the items of information you've given us today, and we thank you for coming to the program.
Thank you for having me.